Good morning, Littleton. My name is Gail Clark, and I have Dr. Richard Caesar here with me. Dr. Caesar is a urologist at Littleton Regional Hospital. And Dr. Caesar, how long have you been here?
I moved here the 1st of November.
The 1st of November.
Yes.
And what made you choose urology as a specialty?
Well, urology is a very interesting subspecialty because we get to practice both medicine and surgery. And I realized that my interest is, I'm sort of more of a surgical personality in that when I see a problem, I like to fix it. Okay. But I also like the aspect of being able to follow patients over time and seeing how they do well with different medications. So it was really a nice meld of the two interests that I have.
And you also practice internal medicine, is that correct, at one point?
No.
Okay.
It was strictly, we actually do a general surgery residency for 2 years, and then we go on to urology for another 4.
Okay.
And I actually did a year of pediatric fellowship after my urology residency.
Okay. Wow. So what made you choose Northern New Hampshire? I always ask that question.
Yeah. Well, I have some New Hampshire history in the sense we have a place down in Canterbury. And we've always loved coming up to Canterbury during holidays and vacations, and we brought the kids up on the lake and so forth. So I've always loved the area, and when an opportunity came up in Northern New Hampshire, up in Littleton, it really was a nice way to sort of bring more of New Hampshire into my life. And I enjoy the outdoors. I enjoy skiing, I enjoy hiking, I enjoy running, I enjoy biking. So it really was sort of, to be honest, I have my kids who are now they're in college, most of them. I have one in high school. The nice part now is we can take some time as a family, couple, to enjoy ourselves in this kind of environment.
Oh, that's great.
So
that's great to hear. It is a wonderful place to live. Now, you mentioned pediatrics, so you treat children and adults? I
do. Actually, most of my practice is adults now, but when I first completed training, most of the practice was actually pediatrics, and there are a lot of children that can certainly, I think, be helped by different procedures that we do and medications that we prescribe and so forth. So I think there are a lot of kids that are sort of underdiagnosed and maybe can be helped that are suffering from different conditions.
And what are some of the common conditions that you see in children? I
would say probably the most common is control of urination and urinary infections. Okay. And we see that quite a bit. And it's particularly in young patients who have control issues during the day and particularly at night, where they're embarrassed about it and it affects their self-esteem. I think having them being controlled at night and telling the parents it's not their fault.
Okay.
They can't control their nighttime accidents.
Really?
And that's a big step because a lot of parents, blame the kids, and really, it's really not the way to go. And there is some ways to help. There are ways to help kids at night gain control until their bladders can accommodate the volume of urine that is produced, and then they can have control. But
so that must make you feel, really good to help a child, because I think too a lot of times when a child has night wetting, I guess that's what I would call it, sometimes that's considered a behavior.
Correct.
Poor behavior. So
right.
it would
has
impact
nothing to do with their behavior.
Right.
It's all has to do with their bladder and the way the bladder has developed. And not everybody's bladders develop at the same rate.
Way. Right.
Some bladders, and it has to do with their genetics. And if you ask most of these families that have kids with wetting at night, they had problems when they were younger.
Really?
Or their parents or their grandparents. So it does run in families, and it's a very common scenario.
So it sounds like that would help the whole family dynamics as well. That's good to know, I'm sure.
Yeah.
That's very good to know. Now, what are some of the common conditions you see in adult patients?
I would say, obviously in men have issues with urination, large prostates, getting up at night, Obviously, in women, we also see issues with urinary incontinence. Wearing protection that they don't need to wear, if we can help them with that. And then, other common sexual dysfunction is a fairly common finding in men. Urinary stone disease is a very common finding here in northern New England.
Really?
Yeah. For some reason, we've seen a lot of stone disease in this part of the state.
Wow. Now, is that kidney stones?
Kidney stones, yep.
I wonder if it's, is it environmental, I wonder?
I don't know. I think it probably has to do with hydration, and a lot of folks are not as hydrated as they should be. And
so how many glasses of water do you recommend?
I'm glad you asked me that question, because I think one of the best ways to prevent any urologic problems, particularly stone disease, is to drink water. And I would recommend usually 5 to 6 glasses a day, 8-ounce glasses, or at least 3 bottles of water a day. Okay. And the other fluids that people consume, typically aren't very good. When people drink a lot of coffee or Coca-Cola, and it tends to cause problems with frequency, urgency, and it's not very good. So water is certainly the best.
Okay, all right. Any other advice besides drinking water on keeping healthy and avoiding any urinary problems?
I think just an active lifestyle, weight loss, don't smoke. Things that common sense things that your primary care physician wants you to do. It's interesting when you talk about sexual dysfunction, and we see a lot of guys who are overweight, and it turns out that their levels of testosterone go down when they do get overweight. And the combination of being overweight, having a low testosterone level, really puts you at a higher risk for other disease processes in your body. So a lot of guys who will come in with erection problems will check their levels of testosterone, and if they're low, we tend to treat them, but I also recommend that they lose weight, because we found that those folks are at a higher risk for heart disease, diabetes. Now there's some other,
related to
this issue. So it's called the metabolic syndrome, and we see it very commonly these days.
Really? Well, I know that, first I know that you're presenting at the 21st Annual Women's Health Conference, and you'll be presenting on urinary incontinence for women.
Correct.
Which is a very popular topic at that conference. So I thank you very much. That's going to happen on Monday, May 14th at the Omni Mount Washington. The hospital offers a women's health conference every year. But in addition to that, you're also going to be presenting a free men's health education session.
Yes.
Which I think is very important, because I can't tell you how many people say, well, are you going to help promote men's health instead of women's health? Well, so can you tell me a little bit about that? Sure.
Well, as we all know, men are obviously less forthcoming about their health issues than women are. And, particularly in this part of the country, there are a lot of stoic guys that tend not to want to see the doctor unless they're on their deathbed. But but it turns out that, there are a lot of specific issues with men that can be addressed, and we can be proactive with their health before they get to the point where they can't have erections, or they're getting up 4 or 5 times a night, or they're having issues with potentially prostate cancer, where we can check their PSA. So I think men really should be involved more in their health. A lot of times women are the ones who are pointing out that, he's doing this, he's doing that. And so we're trying to just make men aware that these are some issues, these are things to look for, and there are some ways to help you with it.
Okay. So Dr. Caesar is going to be presenting here at Littleton Regional Hospital on May 24th it's on erectile dysfunction.
Erectile dysfunction, right.
And anyone that's interested in attending, and it could be husband and wife coming together, they should call 444-0385, that's Dr. Caesar's office, just to sign up for the event because, of course, space is limited, but I think that it's good. I think we really do need to offer men's health information.
Right. Well, I think you bring up a good point, Gail. It is a couples issue.
Right.
A lot of guys will come in and, we really need to have the couple involved in this whole process. Because it's a couple's situation.
Absolutely.
And it's important for men and their quality of life, to enjoy that part of their life.
Right.
So that's what we're going to talk about, how we can help couples, improve that type of
Is there an
situation.
age range, too? That's another question I have. Is there an age range that you see that this happening?
We see it, I would say probably, it varies, but generally between the ages of, 40 and
That
guys
young.
up to 75, 80, they're still active.
Right.
But, obviously issues like smoking make it more likely you're going to have a problem. High blood pressure, other things that can lead to erectile dysfunction we'll discuss.
Okay. All right. That's great. I'm really glad that you're offering that. So again, Dr. Richard Caesar will be presenting on May 24th at Littleton Regional Hospital, and for details, call 444-0385. Thank you very much. I appreciate your being here today.
My pleasure.